board-certified OBGYN physician with over 30 years of experience, I've had the privilege to guide many mothers through their pregnancy journey and beyond. There's a unique topic that you don't hear much about, breastfeeding during pregnancy. Understand that breastfeeding and pregnancy are not mutually exclusive. In fact, breastfeeding during pregnancy can have numerous benefits for both mother and child. However, everyone has the question, is it safe? The short answer is yes. For most healthy pregnancies, continuing to breastfeed is completely safe for mother, the baby inside, and the nursing child. When a woman breastfeeds, her body releases oxytocin. This hormone causes mild uterine tightening, which is completely normal and harmless in most cases. Many experts believe that there is no substantial link between breastfeeding and miscarriages or preterm labor in healthy pregnancies. However, not everyone should continue breastfeeding during pregnancy. If you have a history of pregnancy loss, frequent preterm contractions, multiple pregnancies as twins, cervical incompetence, or placental implantation problems, these are reasons not to breastfeed. In these cases, you should have your individual situation considered by your local pregnancy care provider, who may possibly modify your breastfeeding routine. Breastfeeding is considered the best thing that you can do for your baby. It rarely causes problems with coincidental pregnancy. There may be anecdotal concerns about potential impact on milk supply and the nursing child's overall health. Studies have shown that milk supply may decrease slightly during the second and third trimesters due to rising progesterone levels, but this change is typically not a concern for most mothers. As long as the nursing baby is gaining weight, the milk supply and nutrition should be adequate. Research has found that breastfeeding during pregnancy may have several benefits to the mother, including reduced risk for postpartum hemorrhage, improved breastfeeding success for the new baby, and increased maternal bonding. Some mothers wonder if breastfeeding during pregnancy has any long-term effects on the nursing child. It is unlikely to have any negative effects, and may even have some benefits. For example, studies have shown that children who are breastfed while mom is pregnant may have improved cognitive development and academic performance. Breastfeeding during pregnancy may also reduce the risk of sudden infant death syndrome. Now let's talk about what you might experience. At the end of the first trimester, around week 14 of your pregnancy, you may notice changes in your milk supply. This is due to normally rising progesterone levels from the pregnancy that can affect milk production. By months 4 to 5, your milk will begin to transition to colostrum. By then, you may notice changes in your toddler's feeding pattern. Many mothers experience nipple discomfort due to hormonal changes. This can be caused by a range of factors, including increased sensitivity due to hormonal changes, changes in nipple shape or size, or even skin irritation. Here's what I recommend to alleviate the nipple discomfort. Try shorter nursing sessions. Optimal positioning technique is important. Cool compresses between feeds can help. Lanolin cream application, even Epsom salt compresses for nipple discomfort and swelling can improve the inflammation. As your pregnancy advances, your body will require more calories to support the growth of the baby. To ensure you're getting enough nutrients, consider the following recommendations, which may already be in your multivitamins. 1,000 milligrams of calcium, 600 international units of vitamin D, 600 micrograms of folate, and 150 micrograms of iodine. Stay hydrated and avoid excess caffeine. Your individual needs may vary, so discuss any concerns with your pregnancy healthcare provider. In addition to your daily prenatal vitamin, consider taking separate supplements to support breast health. Popular options include selenium, zinc, and magnesium. By continuing to breastfeed during pregnancy, you may experience a range of benefits. Reduced risk of postpartum depression, improved breastfeeding success, increased maternal bonding, reduced risk of postpartum hemorrhage, and potential long-term benefits for the nursing child. Now I'd like to address some common concerns. You may wonder, will my baby become dependent on my milk if I breastfeed during pregnancy? Well, research has shown that a baby's need for milk does not increase during pregnancy. How will I manage feeding multiple children at once? Some moms breastfeed their kids one at a time. In the case of twins, some moms will feed them at the same time with a child on each breast. You have to evaluate what works best for your family. Can I express milk and store it for later use? Of course, you can pump breast milk and properly store it for later use. Then you can get help from the dad to feed the kids too. Mom always deserves a break. You may observe some changes while breastfeeding during pregnancy. Here are a few things to keep in mind. Your milk supply may decrease slightly during the second and third trimester. Your nipples may become more sensitive and tender. Your breast tissue may become more dense and firm. The areola may increase in size. These changes are common and anticipated. If you have any questions or concerns, you should connect with your women's healthcare provider for guidance. Breastfeeding during pregnancy can be an emotional roller coaster. It's normal to feel overwhelmed, anxious, or uncertain about the journey. Don't be afraid to share your feelings with your pregnancy healthcare provider, family, friends, and especially dad. Here's what I recommend. Be patient with yourself and acknowledge your emotions. Set realistic expectations. Keep talking with dad and other friends and family who can be supportive and help if needed. Focus on the benefits of breastfeeding and the joy it brings to your relationship with your child. Celebrate your successes and learn from setbacks. The baby's father plays a vital role in the pregnancy and your breastfeeding journey, and it's important to empower him with knowledge and support. Here are a few tips to consider. Educate dad about the benefits and challenges of breastfeeding during pregnancy. Encourage him to ask questions. He may see a reason to seek support from your pregnancy healthcare providers or lactation consultants. Involve him in feeding and care responsibilities. Practice open communication and work together as a team to overcome challenges. Learn as much as you can about your body's changes throughout pregnancy for a successful breastfeeding journey. Here are a few ways to stay informed. Keep your regular appointments with your pregnancy healthcare provider. Work with a certified lactation consultant. Join breastfeeding support groups like La Leche League. Involve the dad in the journey. Take prenatal classes. Breastfeeding during pregnancy in most cases is a healthy and safe option that offers numerous benefits for mother, baby, and overall well-being. By staying informed, empowered, and supported, you can navigate this season with confidence and success. Every breastfeeding journey is unique. Most every mother can be successful. You will do the best when you're surrounded by the love and support of your family and friends. You're not alone in this journey. Our team at Stork Advisor wants to help you as well. This is Dr. Stan. Thank you for joining me today. Please join me again in an upcoming video.